From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Ashley Afonso. School shootings, gang violence, bullying, there are many dangerous challenges faced by children and youth in our fast-paced society. Some of these events play out in real time on social media for the world to see. The school shooting in Florida has reinforced attention on mental health treatment in the United States. How do we help the youngest members of our society deal with the stress and challenges and help them become healthy in their bodies and minds? Today on 22 News in Focus, we're looking into ways to improve the health and well-being of children and youth and providing safe environments for them to learn and grow into healthy adults. Joining me today are Jessica Collins, Executive Director of Public Health Institute of Western Massachusetts. We also have Frank Robinson, Vice President of Public Health for Bay State Health and also a professor at Springfield College of Social Work. We also have Kathy Moss, a licensed clinical psychologist at Behavioral Health Network, and Sarah Ringney, a licensed social worker at Behavioral Health Network. So first of all, let's go down the line. Tell us a little bit about your organization and what you do there.
Great. Thank you for having us here. I'm Jessica Collins with the Public Health Institute of Western Mass, and we are a non-for-profit based in Springfield, and we do three services for the region: research assessment, program evaluation, and coalition convening. And many of our coalitions have been around on different public health topics. Live Well Springfield focuses on chronic disease and obesity prevention. The Pioneer Valley Asthma Coalition focuses on asthma, obviously. The Yeah Network was a group working on adolescent health. And for many years, we led the Best Oral Health Program, which was an effort to reduce preschool oral health issues.
So you're serving quite a range of people.
Yes, quite a range, and our work is very much grounded in a concept called health equity, which is really about making sure that all people have what they need to lead a healthy life. And what we do is we look at public health data in our region and stratify it to understand what different populations and communities are experiencing, so that we can advocate and get more investment and resources for the folks that need it most.
And can you just tell us the area your organization serves?
Yes, so we right now are working in Hamden, Hampshire, and Franklin County.
So all of Western Massachusetts here.
Well, not the Berkshires yet, okay, but we will soon.
Okay, and Frank, tell us about your organization.
Yes, I work for Bay State Health, and there's a lot of Bay State Health. I could be talking about Bay State Franklin Medical Center, Noble Hospital, Bay State Medical Center. So there's a lot to Bay State. I'm going to just lift up the specific work that I do, and it's really unique work for our hospital, and that is to be involved in public health. So Bay State's an anchor institution, and as an anchor institution, Bay State is continually making investments in creating healthier communities. And so the work that I do is really around guiding and helping design those kinds of investment opportunities. It may be a grant program to support a community initiative, or it may be starting up something brand spanking new like an accountable care organization. Now that's a lot. Bay State is stepping into providing care differently, where social needs are an integral part of primary care, and in doing that, as an accountable care organization, they will be providing care that actually delivers clinical care in community settings. So it's creating a bridge between what we typically have done clinically and what's going to occur in a new fashion by integrating with community resources. And so I work at that intersection between the hospital and the community.
And this is in all of the areas where Bay State has either a hospital or an office?
Yes and no. So we have a couple of accountable care organizations that work across the region. This is specific really to the Hamden County area. It's a Be Healthy Partnership, is the name of the program, and it actually goes live, kicks off today. Yeah, March 1st.
Okay, great. And Kathy and Sarah, you both work together, so you guys can kind of tell us about your organization and tell us your roles.
Sure, I'll go first. So I'm Kathy. I'm the Vice President of Integration at the Behavioral Health Network. And we are a large community behavioral health organization that serves primarily Hampden County, but we also have services in Hampshire and Franklin County, as well as some services in Berkshire County. And our mission is to serve the community of individuals and families who have some sort of mental illness or substance use or developmental disability. And we work with community partners. My primary role at BHN is to work with schools, preschools, housing developments, medical facilities, primary care practices, and find ways that the different service system in the community can come together to improve the quality of life for individuals who are living with some sort of mental illness, substance use, or developmental disability. So we have a wide range of services. We contract with the state agencies to provide services for target populations. So, for example, the Department of Mental Health or the Bureau of Substance Abuse Services. We also provide services to the general population through medical insurance reimbursements, and we serve from birth through geriatric in a wide range of settings. And Sarah oversees some of our child programs. So
I'm the Assistant Program Director of the Child Guidance Clinic, which is in downtown Springfield. And we are BHN's largest outpatient clinic. And we serve primarily those living in and around Springfield, but including West Springfield, Agawam, Longmeadow, East Longmeadow, et cetera. And I would say a big focus of the Child Guidance Clinic is that we also spend a lot of time creating and building partnerships with area agencies, area schools. And so a big focus of ours and a big focus of mine in the last few years has actually been contracting with individual schools or school districts to really integrate behavioral health services into the school system across the entire range of pre-K to 12.
So you guys are right in there working with people every day. How great of a need do you feel for these type of services?
I mean, it's actually growing significantly. I think a recent measure that I did back in December in one of the districts that we support shows an increase of over 26% requests for just outpatient services over last year alone. And last year, at that same time when I did a measurement, it was 26% higher than the previous year. So we're really seeing those increases year to year, and it's pretty significant.
Okay. Jessica, the Public Health Institute of Western Massachusetts recently released some findings from a youth mental health survey of Springfield students. So can you tell us a little bit about that?
Yes, I'd be happy to. So many years ago, Bay State Health, the Springfield Public Schools, Springfield Department of Health and Human Services, the Martin Luther King Jr. Family Services, and Gandara organizations based in Springfield, and we came together and agreed that we would implement a youth health survey every other year for 8th graders across the Springfield Public School District. And so we released a report in 2015, and then which covered a lot of different health issues. The students get asked over 100 survey questions. And then just recently we released the 2017 data that was around the mental health, the behavioral health questions. And what we lifted up, back to this health equity concept, is we stratified the data to really highlight specific populations and their responses. And so in the report, we highlighted students who identify as LGBTQ, 60% versus 30% of their students who identified as heterosexual, and their reports on feeling sustained hopelessness. We also, so it was 60-30, and then we stratified it by sex. 40% of the girls versus 20% of the boys, had sustained feelings of hopelessness. And then when we stratified it by race and ethnicity, we saw, a distinct range based on the population, as well as a comparison to the state's records. So we try to look thoughtfully at population-based data as to inform where resources and how different strategies and experts should be focusing their time and energy.
So were there any things that really wowed you in that and made you move resources?
Well, we were wowed for sure by, those data points I just said. The 60% of the students that identify as LGBTQ sustained hopelessness versus 30% of their heterosexual counterparts. But in order to get to the where do the resources go and what are the that takes a little bit more time. So it's, involves convening the right stakeholders and really having some very authentic conversations in our region about, where are we putting our resources to lift everyone up.
Okay. What's being done to address stress and other mental health issues among children and teens? That discussion when we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about youth health and wellness. The recent incidents of mass shootings as well as bullying in schools and online and other social stressors are having an impact on the mental health of some young people. Anxiety, nervousness, sleeplessness, and acting out in negative ways or becoming extremely fearful and reclusive are all symptoms that something might be wrong. Schools are seeing the burden of responsibility in dealing with these children. And we just talked about some recent findings, a study on mental health in children. And you guys have some programs that have been based off of data in the past, correct?
Correct. Yes, in our programs, what we like to partner with the schools and institutes like the Public Health Institute of Western Mass that bring us the information on what's really going on for the students and families and school districts and how are we addressing those. So we partner with many of the area schools on delivering program interventions for the students themselves, consulting with the teachers, and also the families. So I don't know if you want to speak a little bit about some of the programs that we're
Yes. So one of the programs that we offer is at Bay State Charter School, in fact. And so we've been there for 4 years, I believe, providing outpatient service, site-based outpatient services. So we have 2 counselors, 2 therapists who go to the school and provide outpatient therapy at the school. And part of that is trying to get to kids who either are not going to be able to get to a clinic, either because they have parents who work, they don't have transportation, there are other barriers to getting to a clinic from the home, and or kids who are struggling in school, and we need to meet them where they're at. And so our goal is to kind of be there and capture them in that moment and then be able to work with them and work with them in the environment in order to really help move them towards feeling and being successful.
So was that a program that was born from some of the data or just seeing a great need for this?
Kathy can talk maybe a little bit better about the inception.
Sure. So usually it does come from data like the YRBS. There's different ways of collecting data. And so whether it's lifted up by the school staff themselves through their anecdotal data or from a quantitative study such as this. I think something else that's important to recognize is that the partnership is what's most critical. And the districts, I'm really proud to say that the school districts in our region here in Western Massachusetts are all very attuned to the social and emotional behavioral needs of the students there. And so we will identify, for example, that I know one of the questions on the survey is there a trusted adult that you can connect with, which is a really strong protective factor for youth, that so many of the youth who perpetrate the kinds of mass violence that we're seeing are people who feel disenfranchised, people who feel disconnected, people who don't feel that their skills and strengths are valued and heard and that they feel part of the school community. So that's a really important indicator for us to pay attention to. And the schools and outside partners such as BHN will look at that number and say, how do we reinforce that? So school districts themselves are putting in a lot of attention into diversifying the offerings for students in schools to make sure that no matter your interests, no matter your skills, no matter your personality, someone in that school knows you, sees you, cares about you, and connects with you. And that's a huge preventive and protective factor towards some of the mass violence that we've been seeing.
So I think the key point is that these needs assessment surveys identify gaps or problems, but they also identify opportunities for strength, for youth resilience, protective factors as Kathy's labeled them. That gives us direction to build where there are gaps or to create additional opportunities to plug gaps. So being connected with a caring adult, being engaged with families in ritual behavior like sitting down to dinner on a regular basis. Those activities map back to positive youth behavior or pro-social behavior in our young people. So we can actually create more of that and create stronger young people.
Okay, so let's turn now to kind of identifying some of these problems. I'm sure each child is different, but what are some of the signs of a child having a mental health crisis?
I'll take that one. I guess, and it's interesting to think about what we mean when we say mental health crisis. And so people think different things when they think that. So if we're talking about a true mental health crisis, usually it's some signs of a severe emotional disturbance or a serious mental illness. Usually there's, in a true mental health crisis, you have a severe risk of harm to self or others. You have disorganized behavior, you have erratic behavior, you perhaps hearing visual or auditory hallucinations, seeing things that aren't there, hearing things that aren't there. With that said, there's usually a crisis team that gets involved to assess the situation and determine if the person needs acute psychiatric treatment, inpatient hospitalization, or something of that scale. I think very often there's more chronic needs that the schools and the community identify that is more related to severe social, emotional, behavioral distress. And so I would think that the families in our communities, for example, would be looking for a dramatic change in how their child is functioning. So one day they're happy-go-lucky and they're engaging in their after-school activities and they're studying and they're engaging with friends. And then over time, so either suddenly or gradually over time, you notice that they don't seem to be participating in the activities they used to enjoy, having difficulty getting out of bed, having difficulty going to sleep, not interested in eating. They may not be hanging out with the same friend group. They may be more secretive and not. Now, a lot of teenagers don't want to share what's going on in their daily life, so that isn't necessarily an alarm. But in combination with all the other things is something that parents do want to sit up and take notice. And that doesn't necessarily mean it's an acute emergency in that moment, but it's something to certainly pay attention to and get help.
Okay, so how do you approach this situation? How do you find not just help, but the right kind of help for your child or friend or whoever you might be worried about?
You know, just to jump in, I think I just want to piggyback off of one thing that Kathy said, which is, you know, I think a lot of the things she described are symptoms we would associate with depression. And I think it's also important to kind of highlight the symptoms we also associate with anxiety, right? So kids who are crying often, you know, don't necessarily know why. They're reporting difficulty sleeping, which can also be a symptom of anxiety. They're having trouble focusing or concentrating when previously that hasn't been an issue. You know, and they're reporting this increased sense of worry that is persistent. Because what we're seeing in the schools and the data that I run, which is different than the data you guys run, it's both qualitative and quantitative, but what we see are rapidly increasing rates of anxiety, and depression is actually secondary in terms of the data we're collecting. So in terms of how do we get services to these kids, you know, calling your pediatrician and having your pediatrician talk to your kid is certainly one avenue. Talking to your school's adjustment counselor or guidance counselor, those folks are much more easily, you know, able to access kind of mental health services in the area, and they know of them. And, you know, certainly when we have relationships with them, that allows us to kind of get in more quickly. Clergy, if you're involved in any faith organizations, those are people you can go to with that kind of information to ask or seek help.
Okay, now if someone has insurance that won't cover some of this, what are some of the resources available to still get them help?
So that's an interesting question for this state and for youth in our state. I think we were somewhere around 95, 96% of the children in the state of Massachusetts are covered by some insurance. So we're unlike other states. So for that 2 or 3% that may be outside of the insurance market, what do you guys do with them? and actually, they're probably children that are not documented, perhaps, and are not eligible for insurance. So whatever is happening there is a bit of an ad hoc or in a voluntary capacity. But
yeah, I would just add to that, the children in Massachusetts are eligible for health insurance, and so most of the children that we serve, that's not an issue, it's not a barrier for them. But there are state grants and school departments help, so there are other sources of funding that those kids can get looped in for services.
Okay. We'll continue our conversation after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about youth service and wellness. President Trump discussed the issue of mental health care with governors during a meeting last week, and the administration says it's exploring ways to help states expand inpatient mental health treatment using federal funds from Medicaid. One roadblock to the change might be a federal law that bars Medicaid from paying for treatment in mental health facilities with more than 16 beds. So, first of all, should universal screening for depression or mental health issues be required for children and teens?
I would love to respond to that, and I would say that is the movement in this state for sure. I think we're seeing that for the Children's Behavioral Health Initiative, which certainly covers children and youth who have Medicaid insurance here in Massachusetts, are screened by their pediatrician, and there are also screenings that happen through the schools. So we are looking for and through the ACO reforms that Frank was referencing earlier, that there is universal screening being rolled out for children, youth, and adults for anxiety, depression, substance use, and social determinants, which is a considerable factor in driving mental illness.
Can you tell us a little bit about that process?
So, as part of the reform, healthcare reform, putting social into the healthcare setting, 100% of the members joining the ACO will be screened for social needs. That may include food, clothing, shelter, housing, may address other challenges, and some of them, as we're talking now, have to do with mental health and mental health needs screening. Those screens then generate a care plan, and the healthcare provider, now in partnership with a behavioral health network or a behavioral health provider and or social service providers, put together an intervention or a service that basically is more complete, more comprehensive. In the old model, we would screen for medical needs, we would observe social needs, but it was never really integrated as part of the overall plan.
Is there enough residential programs to meet the demands right now?
You heard an easy no over here.
Yeah, that would be a no. And I think whether you're talking about adults or you're talking about children, the answer was somewhat different. But we really struggle as a service system in having enough higher level treatment facilities available for the need, to meet the need.
That no happens across the board. So for every child or adult that shows up in any one of the emergency rooms in the state that requires a higher level of care, residential care, they don't need hospital care. They might need treatment or substance abuse treatment care, mental health treatment. There literally are not enough beds anywhere in the state. So it's a very serious problem.
I would say that our state government is very aware of this. Massachusetts is really working hard with us. The Department of Mental Health and the Executive Office of Health and Human Services is working with provider organizations and payers to find a way to bridge that gap. They are very well aware of it and are working hard to find a way to fix it.
So if beds are not available, what's the other option right now?
Invention. So I think part of this transformation, we're talking about transforming care to be more socially oriented, is really creating alternative models for care. So what can be delivered appropriately, safely in a clinical setting that typically would have required a hospital or residential setting. Again, that captures some small portion of the need, but the challenge and the lack of beds is pushing the systems to be more creative and more responsive. So it might be emergency respite or transitional care. Some additional housing resources might be provided through MassHealth to support an existing care situation. So there are those solutions, but they're soft solutions, and they don't necessarily address the folks that you've identified as needing acute mental health care or acute residential care.
Jessica, does some of the research you guys do go to the state? Do some of our lawmakers see the research?
Yeah, that's a great question. So our report we always send to our Western Mass delegation, and there is the youth risk behavior survey data, which is done in 10th and 12th grades that the Massachusetts Department of Public Health collects across the state. So yes, they have statewide data, and then we're lucky because we have more robust local data. I just want to add too that they do the same surveys up in Franklin County and in towns, obviously towns across Franklin County and Hampshire County as well. So, and you know, again, the survey data that we collect is really on a population base, so it allows for us to be more thoughtful for the future in order to get resources for prevention. What this conversation is about, which is really important, is more kind of after the fact, and so we know who we should be focused on. And the other thing I just wanted to say is there were many students in the Springfield Public Schools that helped us collect that data and put out videos and spoke to their classmates about how important a survey like this is.
Getting kids to participate, I'm sure, is not always the easiest task.
They were great.
Okay, let's talk about children in foster care who go through the system. What kind of services are there for them so they don't get left behind in this whole process?
So I would say they have, so we have strong partnerships with DCF and DYS, and they know about our services, and so it's not uncommon for us to actually get direct referrals from those agencies for kids to make their way into outpatient care. I know a lot of our kids who are in DCF care, outpatient therapy is mandated, so it becomes part of the process of being in foster care is that you have to be talking to someone about what your experience is like.
Okay, now how about children with some kind of learning disability or physical disability? What kind of services are there for them?
Those services tend to originate out of the public schools. So very often those youth are identified, those children and youth are identified through special education assessments in the schools. And through that channel, they are recommended for community supports. And there's a range, depending on the needs and the issues. There are a lot of services in the community. Adults with disabilities, there's a fair amount of services for youth, it tends to come through the schools. I would say just one more thing about the link that I'm really hopeful about how Massachusetts Medicaid reform is taking all of these things, that the care management component that's built into the accountable care organization structure. I'm hopeful that there is one of the greatest risks right now to serving the people in our community are these cliffs that happen between service providers. So the kid who's aging out of DCF custody or the child who's moving foster home to foster home, the DCF is involved. And when DCF ends, if they close the case and the family isn't voluntarily seeking services, they may fall through the cracks and not continue to get services. Mental health services, except in severe cases, is voluntary and takes a fair amount of initiative on the part of the individual to seek and sustain those services. One of the brilliant things about Massachusetts Medicaid reform is they put these care management entities in place whose job it is to really track those folks over time and to make sure as they move from one service system to another that somebody's paying attention and helping them navigate the system. And hopefully we're going to help prevent the situations of people falling off the radar of the service providers.
So when we're talking about the great need for more services, is there more of a need for children or adults, or are they both very high?
I think they're both very high. I couldn't judge one over the other. I am concerned, and I'm going to sort of piggyback Kathy's point, is that there is this increased focus around transition, overtime, care management, focus on social needs, and Mass Health is building the muscle of the healthcare providers to deliver on that. But someone has forgotten the social service providers that will receive the additional referrals. So we have somewhat of a lopsided equation right now. And if we can become really good at identifying needs and referring need, the assumption is that the resource is immediately available. In the same way that there aren't enough beds, there will not be enough community-based resources or services to supply this increasing need that we're going to generate. So it's a bit of an experiment, and we'll experience this tension over the next year or two. But that's a cautionary tale, so to speak. We think we got it right, but I think we may have half of it right, not the whole thing.
So while there's still a great need for resources, it sounds like things have come a long way in recent years.
I'd love to give an example of that. So the Children's Behavioral Health Initiative is a court-mandated program for children with Medicaid services. And there is a wide array of services available. The challenge is getting there and staying. And that's where the care managers and other folks can be really supportive.
The home environment plays an essential role in a child's health and development. We'll learn more when we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we've been discussing health and wellness issues among children and youth. The home environment plays a central role in the child's development, along with proper nutrition, exercise, and sleep. Many children from low-income families get both free breakfast and lunch through school. These programs, along with SNAP benefits, are facing budget cuts, reducing families' access to healthy food. Many schools are also cutting music and art and reducing the amount of gym and recess time children get in order to reach academic testing standards. Low-income children tend to live in higher crime neighborhoods, so some parents won't allow them outside alone. These and other factors come into play when considering the health and well-being of children. So let's talk about hunger. How does a child's hunger affect their mental health?
Well, their mental health, so clearly hunger would trigger some type of adrenaline response. Yeah, and I think, you know, to your point about your opening around school and academic achievement, obviously it's really hard if you're sitting in a classroom and your tummy's rumbling to be focused academically. So it's true, school districts have gotten more creative about serving breakfast after the bell, making sure breakfast is universal. What we focus on is making sure that it's high quality food, because you don't want to just be serving kids food for the sake of calories. You've got to make sure they're nutritional. So that is definitely something that our region is well aware of.
Okay, and obesity continues to become an issue. While those numbers are going down, there's still a problem. So how does a child's physical well-being affect just their well-being in general?
Yeah, and that's a great point. And I'll just say that absolutely in the state we have got to figure out a policy requiring physical activity during the school day. Over the past decades where there's been so much focus on standardized testing and MCAS, schools have taken it upon themselves to reduce that amount of time where children can be physically active. And there's so much research now that's come out more currently around physical activity, brain function, and actually increased academic achievement. So we have got to get policies in place that require certain amounts of time for physical activity.
Yeah, I mean, these are really practical solutions. I'll talk about there's a program called MIGHTY, the MIGHTY program. Dr. Krista Whitcop out of Bay State Medical Center operates this, and it's a obesity intervention program for obese children. But what's unique about it is done through partnership with the YMCAs, both in Springfield, Westfield, and I think in Franklin County now. And it's an interesting blend of community resources and healthcare providers or physician resources addressing the needs of the child. And they do it within the context of the full family. So the full family is involved in the intervention. Phenomenal solution, potentially scalable, and could be spread to other schools, other communities.
What are some issues that children have that are linked to lack of physical activity?
Well, I'll maybe let the clinical experts over there take a leap, but absolutely, you know, obesity, chronic disease. We're seeing more children now who have type 2 diabetes, where that was historically an adult onset disease. But
Depression and anxiety are significantly impacted when people don't get enough physical activity, because
I think it can be a really vicious cycle where you know, one thing begets the next, you know, and so they feed into each other. So once you kind of get started on that loop, it can kind of be easy to be caught up in that cycle.
Some children are also labeled with either hyperactive or ADHD. Can physical activity help them focus in the classroom at all? Some of those little programs, recess and getting up and moving during the school day?
I think definitely, and it's interesting, we did looked at data in our community of Springfield a couple of years ago, and we were able to kind of compare how many children at different schools were diagnosed with ADHD. So I would say that I think our community has a lot to learn regarding this disease and this new classification of students. And I mean, I would say yes, absolutely providing more opportunities for physical activity, but reducing stress as well, so that children can, you know, just have sort of healthier environments, that they don't have to be kind of ramped up with anxiety and adrenaline, that I think then manifests itself into these diagnoses that, you know, become medicated as opposed to more playing time at the park.
So what kind of programs do you think would help?
Well, I'll name one that Wayfinders is leading in the Old Hill neighborhood of Springfield, which is that they've been working for a couple of years with many community partners and funding from Bay State Health and Mercy Medical Center. That has actually been very successful in kind of taking back the parks, and parents have gotten involved in really trying to reclaim park space and street space so that children can get out and be more physically active and play on the weekends, and working together with the Springfield Police Department to both, you know, reduce crime and get more people on the streets playing, and that's been very successful.
When we talk about ADHD, you hear a lot of people in older generations say this was never an issue when I was a kid, or we never heard about it. Why is that?
I'm going to defer to you to start. Right?
I'm happy to do that. I think there are a number of factors involved. I think the symptom profile that is labeled as ADHD can come from a myriad of factors. And so sometimes there is the genetic or the biochemical attention deficit hyperactivity disorder, which has one trajectory. I think there are many other causes that lead to the same profile of symptoms. I think it has some to do with what we expect of our kids. I think what you've just been talking about the lack of outside time, the lack of physical activity, the lack of an opportunity to be creative and to follow your own ingenuity, I think is something that results in having kids who are looking more hyperactive and inattentive. I think screens are a big factor that we can't overlook, that what we didn't have 20, 30, 40 years ago is the amount of screen time that our children are exposed to now, and the kinds of things that that does to your brain. There's a lot of research now that's looking at the impact of screen time on brain development. There's a lot of research out of the Harvard Center on the Developing Child, which looks at a lot of brain development science from prenatal through early childhood, and how that affects your ability, the frontal lobe ability to manage attention, emotion regulation, executive functioning, all the things that ADHD is deficit in. And they're looking at how toxic stress affects that. And so toxic stress is a lot related to the social determinants work that we've talked about earlier. Is if you're exposed to chronic violence in your community, hunger, stress, things like that, how your brain develops does not allow you to have the executive functioning, is what they call it, so planning and problem solving that you need, and it often ends up labeled as ADHD.
Okay, after the break, we'll learn about some programs and resources for struggling children and youth. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about health and wellness for children and youth. Each of the organizations offers resources for physical and mental health. So let's talk about some of the resources that are available through your programs.
Well, I'll just say that after we released this, the Springfield Public Schools data with regard to adolescent mental health, we are convening a number of stakeholders to talk about how can we better support these students and how can we set up longer-term prevention strategies.
Okay.
So, similar to the mighty example I offered earlier, the connection of the health provider with the YMCA's to create a more robust program for both the child and the family. Healthcare alone could not deliver that program. We need a community partner that brings to the table a different set of skills and different understanding of family. So if you think of this intersection of healthcare with community care, broadly speaking, it's a partnership with Behavioral Health Network. They're behavioral health experts. Healthcare alone can't deliver on that. We need a partner to do that. Similar example, the Bay State Academy Charter School was referenced. Well, Bay State has an out-of-school time program, and we discovered that our kids that had a health career aspiration, college aspiration, needed something more. So we made an investment with a set of community partners to establish the Bay State Academy Charter Public School. It could be our Family Advocacy Center. This in partnership with the DA's office and DCF and other folks to create unique programs to address high-risk children and families. So in almost any instance that we can talk about, our resources tend to stop short of what the family needs, and in order to get the full resource package assembled, we need to partner with a community organization. And so I think that's the opportunity that's the place that we're at today, looking for those kinds of partnerships around the new ACO, the Be Healthy Partnership for Mass Health members, as well as for the traditional work that we do with most of our other patients or members.
So what kind of these community partnerships, what kind of organizations are you looking to work with? More schools or?
So I think the schools, obviously, which is really a great place. You have this captured, defined population. You can step in there and work with them. Regular schools, early education and care, preschool settings are great examples. We build partnerships in a very intentional way. Martin Luther King Jr. Family Services, they provide a range of services that are essential for patients, as is the case with New North Citizens Council. I lift those two up because those are two that I'm working with currently. Currently building a partnership with the Food Bank, who is part of this coalition in hunger. If we think of this food question earlier, they themselves are then connected to Catholic Charities, Wayfinders, Valley Opportunity Center, so they come with a whole network of other community organizations, and so we partner with them. We get the benefit of making a contribution, but also receiving a blending of resources that make it more complete, more comprehensive services for our families. So we can imagine, or I can imagine, partnering around a lot of things with a lot of different organizations, big and small.
Okay, let's talk about some of the resources at Behavioral Health Network.
So BHN is one of a number of community behavioral health organizations in our region, and we all offer a wide array of services and programs. I would echo what Frank said, that I think our strength is in collaborations. And the best way to access our services are through either directly through calling Behavioral Health Network or one of the other peer organizations like BHN, or through your trusted partners that are already in the lives of the children and families that are looking for help. So if you call your school guidance counselor, they will be able, or adjustment counselor, they will be able to hook you up with programs like Sarah runs. If you access your pediatrician through Bay State, they'll know who to connect you with and how to get help for those families.
Okay, what kind of public and private funding is needed to expand the mission and fill some of the needs that we discussed earlier in the show?
Yeah, I mean, that's a great question, and that's absolutely what it takes, is the public and the private sectors coming together to think about what is the population we want to have for the future of our region. How are we going to make sure that our young people, our future, is healthy and grounded? And I think coming together around specific, either funding for specific organizations, is really important, that provide protective factors for young people like we were talking about. And then there's sort of the prevention funding, and then there's the funding that's really necessary after young people and older people are diagnosed and have been identified. So for us, we look to private entities to work with us, with public sector, to advocate for appropriate policies, like I mentioned before, physical activity during school, healthier food, resources in connecting healthcare, to community-based organizations. It's all essential. And so when we convene people, we try to then identify strategies and then what would be the funding specifically for support. But right now, I would just like to say, again, based on that report, for the students that I identify as LGBTQ, if there are folks out there and private sector folks that would like to invest and support those young people, we're trying to give specificity so that people can feel moved and passionate about supporting specific, groups of folks.
After all of these horrific shootings and different things that have happened around the country, there is a conversation around prevention. Are you seeing more of a spotlight on your kind of organizations now to help people and reach out to children in particular to prevent some of?
Oh, geez, I wish we were, but no. I mean, not from the gun violence you're saying. Is that correct? That's what you're referring to? Or?
Some, and then other bigger...
we got a lot of attention from the report because I think the report did really shock people. As many people said, oh, we already knew that, but now you're really looking at critical populations. But I don't know if you all have received more.
Yes.
Yes, okay.
And I think there's a lot of debate out there in the world. A lot of people referring to mental illness as the underlying factor that causes this kind of violence. And I think it's really important for people to understand that that's not the case, that most people with mental illness are not violent, and most violent incidents like these mass shootings are not connected with mental illness, actually. And I think when you asked earlier about funding resources and where the gaps are, I feel very strongly about this myself, that so many of the profile of these mass shooting perpetrators has more to do with their disconnection from their communities and their lack of ability to regulate their own emotions, have good problem-solving skills, the things that you learn in early childhood. And one of the biggest gaps that we have is the lack of attention on the needs of our youngest children. There's so much research that shows from birth to age 5 that you are developing the brain structures that support that. And for our communities to put more investment into supporting those young children and their families to get started off right, understanding who they are, what their strengths are, where they fit in the world, how they interact with the people around them, so that they don't end up being somebody at 16 or 26 who feels disenfranchised, resentful, angry, and unable to resolve their problems in any way, excuse me, in any way but violent.
I got to just make a really quick comment. Investing in creating more mental hospitals is tossing resources out the window. I came out of an era of closing the Northampton State Hospital, so I was part of that process. Had that hospital remained open and had that hospital been in Florida or other places, it would not have prevented this mass shooting. I think it's an adult problem. Somehow that young man, as troubled as he was never adequately connected to or attended to by adults. So I think it's an adult problem, and a hospital is not going to solve that problem.
All right, we'll have the last word after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about the health and wellness of children and youth and the resources available to support their well-being. That's our program for today. We want to thank our guests for joining us and thank you at home for watching. If you missed any of it, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday.